In recent weeks, the US, EU, and other high-income countries have pledged to send hundreds of millions of doses of COVID vaccines to low and middle-income countries. However, many of these deals are yet to be realized and exports have not matched demand. Although life is starting to return to normal in the US, lower middle-income countries are still experiencing the full burden of the pandemic and loss of life. I would like to discuss which countries are exporting vaccines and why vaccine exports have not ramped up to meet donation and purchase deals. Let's take a look which countries are exporting vaccines. In early 2021, India was a leading exporter of vaccines and had exported over 66 million doses of AstraZeneca by mid-April. However, after a devastating second wave, India stopped all exports to redirect doses for domestic use and will most likely not resume exports until the end of 2021. China started exporting vaccines at the beginning of 2021 and has remained one of the top exporting entities. They have exported over 400 million doses, primarily of Sinovac and Sinopharm. Chinese exports have reached many countries, but many of the deliveries are yet to be completed or consist of a small number of doses. The EU has exported over 350 million doses globally, but many doses are not reaching the countries which need them the most. As of April 2021, over half of the doses exported from the EU went to the UK, Canada, Japan, and other high-income countries. Finally, the US pledged to donate more than 500 million vaccines, but the US is still falling short of its export timeline. In the first week of July, exports totaled around 40 million doses. The US only started exporting vaccines to Africa in the second half of July, where many countries still have only fully vaccinated less than 1% of their populations. Why does this matter? The countries which have not yet received vaccines are the ones at greatest risk. The Delta variant is spreading rapidly and overwhelming more and more health systems. We have seen waves of the virus devastate parts of Latin America and Southeast Asia. Cases are rapidly rising throughout Africa, and increased distribution of vaccines may already be too late in parts of the continent. Leaving vast numbers of people unvaccinated not only results in loss of life, but also increases the chance of new and worse variants. What needs to happen in the short term? Currently, many vaccine purchases are being filled in the order they were made, despite the fact that several high-income countries ordered enough doses to vaccinate their populations multiple times over. In the short term, vaccine distribution should be prioritized based on per capita need and not order date. Additionally, financial support is required to strengthen delivery infrastructure, supply chain, and storage capacity of vaccines. Vaccine distribution must be restructured globally in order to rapidly increase exports and distribution to lower middle-income countries. Vaccinating vulnerable populations around the globe is essential to reduce the burden of the pandemic and prevent immense loss of life. Thank you.